This will be a review of cataract surgery. I was about down by 7 or 8 diopters as a result of my own habits, honestly, and a strong minus lens, which was repeatedly overprescribed. I don't really blame anyone for that. It's just a bad habit of child and excessive prescriptions. So forgetting that, if you're 60 or so and are having development of cataract, which is protein in the lens, you gradually lose the ability to see in darkness or backlighted situations. So I had no choice but to get cataract surgery. If you get it, find a good surgeon. Find that's his major job. I also had the threat of detached retinas, which were stitched over the years, so I didn't actually get it. But before the LASIK or the cataract surgery, a surgeon really looked at my retina, and he was concerned. The surgery went well, and it takes about 2 days for the operation to take effect, and I was close to 20/20 in one eye. What follows then is about 6 weeks, and then they do the other eye. Using my Snellen here, I was pretty close to 20/20. What happened then, after about 2 years, I developed what they call a secondary cataract, which is again clouding of the image, but I was able to check it, so I knew it wasn't a refraction problem. Went back, and again they used LASIK to clean off that dustiness. So that works. But once out of it, I never wanted to get back into it. I don't ask a person to do something I would not do. I don't ask a person to get out of it unless they're reading the 20/40 line and have the motivation to do it. It's hard to understand why a plus should be used when you're 20, 30, or 40, but you should work on that one. I don't see how anyone medical could ever guide you in doing it. It's unfortunate, but that's the way it is. I don't think a lot of LASIK. It cuts the cornea, and you get secondary effects which can't be fixed. Maybe 5% of the people get this effect. And once you get it, you can't fix it. Almost everybody's happy with LASIK. Again, I think the world of medical people. I think they're nice, but I think the real issue is for the person to have the education to start prevention when it's at 20/40, like it or not. It's intellectual and it's something you must decide for yourself. Again, Frank Young's study, conclusive. You can't get out a lot of it. And long-term plus wear, which is not medical, not a medical goal, is the only way you'll prevent it. And then in event, if you're close to getting cataracts, talk and have it done. That's great when it works. Thank you.